The chair of the full committee, Chair Rodgers, for 5 minutes for her opening statement.
Thank you all for being here today. We have talked a lot in this committee about addressing the impact high health care costs have on patients, employers, and taxpayers, and the work that we need to do to create a less complicated system. More than 60% of Americans are living paycheck to paycheck. It means that they're just one medical bill away from a financial emergency, one doctor visit away from not being able to pay their rent or put food on their table. Let's take, for example, a new mom who has what is considered a good health care plan. All her plan's documents say maternity care is covered. After a few weeks at home enjoying life with her new healthy baby, she gets a bill from the hospital for over $18,000. Next, she receives an explanation of benefits from her insurer. A number of items were denied, but it's not clear why. It claims she may still owe over $6,000. A month or so later, another hospital bill finally shows up for $1,800. So for one childbirth, that's 3 different documents with different amounts for this family to pay. This is just one example of how the current confusing and opaque system plays out for every day in millions of lives for Americans. Something needs to change. Improving price transparency in our healthcare system is a critically important step to begin to address these problems and drive down cost. We ended last year with a very important moment. Our Lower Cost, More Transparency Act passed out of the House by an overwhelming bipartisan vote. But our work is not done. We need to get this legislation onto the President's desk to improve price transparency for patients and employers as soon as possible. Today, we're hearing from experts on why addressing healthcare cost is so important and what more Congress should do once the Lower Cost, More Transparency Act is signed into law. We will hear about how much we are spending on healthcare. In 2022, spending on healthcare in the United States reached nearly $4.5 trillion. That averages out to about $13,500 per person. Take a family of 4. That means on average it will cost more than $55,000 a year to provide healthcare for that family. Now, of course, not every person or family is average. Some will require more spending, some less. But we all pay the high cost of healthcare through ever-increasing insurance premiums, through our tax dollars, and we know that when employers have to spend more on healthcare, they spend less on wages. One study found that the growth in healthcare premiums over 3 decades resulted in $125,000 in lost wages per family. In other words, when we lower healthcare costs without sacrificing access and quality of care, we are helping increase the paychecks of hardworking Americans. Spending on healthcare is projected to continue to grow faster than the economy over the next decade. This trend is not sustainable, and we have to find a way to reverse it. I believe a foundational first step that is necessary to lowering healthcare costs is improving price transparency. But our work does not stop there. There are plenty of other examples of things driving up costs for patients and employers. One such example is vision insurance, an area that has seen significant consolidation and vertical integration over the past decade. And this has led to the same companies controlling the production of frames and lenses, owning and operating nearly all the laboratories, employing the doctors, and owning independent practices. The result is less transparency and higher costs for treatment. And that's why Chairman Guthrie and I are requesting that the Government Accountability Office examine this issue and help inform the committee on how we can bring more transparency and lower costs for Americans. There are many examples like this one, which is why we're holding today's hearing, to examine how much we are spending on different parts of the healthcare system and to discuss potential solutions to lower cost and put money back into the pockets of hardworking Americans. I look forward to hearing from all. Thank you, witnesses, for being here, and to my colleagues, I look forward to hearing your ideas too. I yield back.
Thank you. The gentlelady yields back, and the